So good day, I'm Ivan Mendaros, a second year student from Davao Doctors College. And now I'm going to perform the parenteral drug administration return demonstration. Parenteral drug administration refers to drugs given by the routes other than the digestive tract. Administration by injection includes the following route: intradermal, subcutaneous, and intramuscular injections. And now I'm going to perform those three different routes of parenteral medication with the same preparation phase before we actually proceed with the actual administration of the medication to the patient. The first thing we would want is to check the doctor's order and the medication administration record, or the MAR. To identify what drug is to given to the assigned patient, we have to determine the drug's name, the dosage, the route of the administration, and the time is to be given. So next, we also have to check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. Now, in preparing the medication administration, it is important to follow the three checks for administering medication. Read the label on the medication. First, when it's taken from the medication cart. Second, before withdrawing the medication. And third, after withdrawing the medication. Next, we're going to organize the equipment needed to promote time efficiency. To prepare the medication, of course, we need to have the syringes. I have a tuberculin syringe, insulin syringe, and a 5cc gauge syringe, and an aspirating needle, and hypodermic tray, and forceps. Alcohol, sterile water, which will serve as a medication. Cotton balls soaked in a 70% alcohol solution, and I have waste receptacles. This is where I will dispose the used needles and syringes so as to avoid needle prick injuries. Now let's proceed with the preparation of medication. Preparation of medication. For the preparation of medication from vials, we're going to perform hand hygiene to prevent the spread of microorganisms and to observe other appropriate infection prevention procedures. So prepares the medication vial for drug withdrawal. So the first thing we're going to do is to confirm the medication. Or the ceftriaxone. Next, mix the solution if the necessary by rotating the vial with the palms of the hands, not by shaking, in order to mix the aqueous solution that tend to settle. Remove the protective cap or clean the rubber cap of a previously opened vial with an antiseptic wipe by rubbing a circular motion to reduce the number of microorganisms. Then withdraws the medication. Attach a filter needle as agency practice dictates to draw up premixed liquid medications from multi-dose vials, and we must ensure that the needle is firmly attached to the syringe. The filter needle is helpful in order to prevent withdrawing solid particles. So remove the cap from the needle. Then draw up into the syringe the amount of equal to the volume of the medication withdrawn. So now carefully insert the needle into the upright vial through the center of the rubber cap, maintaining the sterility of the needle. Then inject the air into the vial, keeping the bevel of the needle above the surface of the medication. Again, the airway is helpful in order to easily withdraw the medication. Now gradually withdraws prescribed amount of the medication by holding the vial down. Hold the vial down, making sure that the tip of the needle is below the fluid level, since keeping the needle tip below fluid level is helpful in order to prevent withdrawing air. Now recap the dispose and filter into the sharps container, and then we have to replace the needle that will be in use for the administering of medications. Now let's prepare for the ampule withdrawal. So first we have to confirm it paracetamol nephrex. So in doing this, we need to flicker its top with using our fingernails to ensure that there are no air bubbles on the top, because there are instances that some medications are left on the top, so we have to ensure that there is no medication left by. Now place a sterile gauze. Pad into the neck of the ampule, then we're going to break it in this motion, like snapping motion, or whatever actually breaks the broken parts are away from our body, so we don't cut. So take the gauze pad around the head, and then just snap it off, like, then you're going to take this part of the head of the ampule, and you're going to dispose of that in the sharp bin, so you don't cut yourself along the gauze. Now withdraw the medication. The first thing we have to do is place the pill on the flat surface, and then we have to attach the filter needle to our syringe firmly and remove the cap. Then we have to hold the ampule slightly towards the inside in order to obtain more than the amount of the medication prescribed. Now carefully withdraw the medication prescribed. Okay, next dispose the filter. Okay.
1, 2, 3, go.
Okay, next dispose the filter needle by placing in a sharps container. If giving an injection, replace the filter needle with a regular needle. Tighten the cup at the hub of the needle and push solution into the needle to the prescribed amount. So the first parenteral medication that I'm going to perform is the intradermal injection. Intradermal injection is commonly used for tuberculin skin testing, but can also be used for allergy testing and local anesthetics. So prior to conduct the procedure, the first thing to do is to check the doctor's order on the patient's medications administration record, since the chart of the patient is more reliable than the medication ticket, and of course to know what medication should be given to assigned patient. Okay, the next thing we're going to do is to introduce ourselves and verify the client's identity using agency protocol to be sure we're performing the procedure on the correct client. Then we're going to explain the procedure to the client so that they will know how they can participate during the procedure. So good day, ma'am. I'm Ivan Mendaros, your student nurse for today. May I know your full name and may I see your wristband and birthday? Please state.
Kayo po rin bukas, October 7, 2001.
Okay, thank you. So, Dr. Ramirez has ordered for a penicillin skin test, which means I'll have to inject just a small amount of penicillin into your skin to check if you are allergic or not with the penicillin medication. Will be that alright to you, ma'am?
Yes.
Okay. After that, perform a hand hygiene and observe appropriate infection prevention procedures to prevent spread of the microorganisms. So the next thing we're going to do is to arrange the medication card on hypodermic tray with the corresponding drug to promote time efficiency. Okay, now choose an injection site free. Select the side 3 to 4 fingers with below the anti-cubical space and one hand above the wrist. The forearm is convenient and easy location for introducing an agent intradermally. Position the patient's arm so that his elbow and forearm are supported in a flat surface. After that, apply clean gloves and avoid harboring microorganisms. And use an antiseptic to what I said, but use an antiseptic swab to clean the site beginning at the center in a circular motion outward about 2 inches or 4 to 5 centimeters. Now stretch the skin. Taunt at the injection site by pulling gently with a thumb and forefinger at your non-dominant hand. Taunt the skin will provide an easy entrance into intradermal tissue. Pull the needle very closely to the patient's skin and insert slowly at a 5 to 15 degrees angle until you feel the resistance. Advance the needle up to the epidermis about 8 to 10 inches or 3 millimeter. And slowly inject the medication and feel the resistance until you see a bleb that resembles a mosquito bite will appear on the patient's skin. If it will appears, this means that all solutions are in the intradermal tissue. Now withdraw the needle at same angle that this was inserted to minimize the tissue damage and discomfort for patient. And pat a dry cotton ball and do not massage the area. Now encircle the blood with a blue or black ball pen and instruct the patient not to rub the wheel or erase the mark. Please do not rub the mark, mama. Red pen may influence the reading and massaging the area may interfere with the test results and spreading the medication to the subcutaneous tissue.
Okay.
Now assist the patient into a comfortable position to consider the well-being of the patient. Are you in a comfortable position now? Okay, then indicate at the back of the medicine card the site and the due time of reading, which will serve as a reminder for the nurse on the procedure done. Now, don't recap the used needle and dispose it at the waste receptacle to avoid needle prick injury. Then wash hands to prevent the spread of microorganisms and document the procedure and interpret the result after 30 minutes to prevent medication errors. Okay, ma'am, we are done with your skin test, but we still have to wait for a few minutes to have the results. Is that be okay? Okay, I'm going to leave you here so that you can have some rest, and please do not massage the area where I did the injection, and please do not remove or erase the mark. So okay, I'm going to leave you now, and I'll be back after a few minutes. Is that be okay?